ask you about your company. I think it's so interesting because I was looking at your website and I have to say something because it's so great. And I hope you include this. I have to put my glasses on because I'm blind. But
How you say it's so great? 'Cause it really, honestly, Elizabeth, I need to update it.
well, maybe I'm old school, but I look at this and it's so clever. Like the clinical research professional to clinical research associate makeover utilizes the CRA method, intentional steps to a CRA method. And I've never heard anything like that before. And it's very cool. Don't take credit for the neat thing you've done.
Thank you.
You're welcome. Can I ask you, I know this interview's about me, but if you don't mind, I want to ask you, how did you start your business? If you don't mind me asking.
No, hey, this is all about you and what you want to ask and tell. So I'm more than happy to share. So for me, becoming a CRA was a little bit more of a challenge. And I guess you could say I was maybe a late bloomer because I didn't become a CRA until like 29 going into 30. But originally, I wanted to be a bench scientist, believe it or not.
Wow.
So I had the research thing going on, but I didn't know about clinical research, honestly. It wasn't until I was in my PhD program at UNC Chapel Hill, and I was in a translational research lab, oncology to be exact. We focused on like cancer, molecular cancer biology, and pharmacology. And it was like, because it was translational, we had the bench science preclinical research side, but then we also had the clinical research kind of piece going on too. Not in the way that, we get to interact, but more so along the lines of dealing with the data, the statistical side of things.
Okay.
But it piqued my interest because I had never been exposed to that side before. So the more I learned about it, the more I realized that that was actually the path for me, because even going back further, I originally wanted to go to medical school. But in undergrad, after, getting to my senior year, getting ready to take the PCAT and things like that, after the more exposure I had to physicians and their lifestyle, I just said that was not for me. So going to be a scientist was an alternative route, but then I felt like I was missing that clinical piece, because being in a, no shade to any scientist or anybody at the bench, but it can be so mundane and so boring and so repetitive. And there's only so many times you can run a Western blot or PCR or, it's just so many times you can run that experiment. And then dealing with the small animal models. I love animals. I don't know about you.
I love animals.
Me too. And even with the mice, I remember having one time we needed the brain from a mouse to do some studies, and we had to anesthetize and do the procedure while he was still alive. And I just cried the whole time.
Oh my God.
I couldn't finish the day. It was like heartbreaking. Like I have lost a family. I just couldn't continue like that. So, fast forward, I realized the perfect combination was clinical research.
Right.
And originally I was thinking about the MSL role because I was in the PhD program, and that was kind of like, most of them, they have an advanced degree, and most of them doctorate level, but I just could not stay in my program another day. I had already done 3 years. And on average, for PhD students in those type of biomedical sciences, it takes about on average 5 to 6 years. Sometimes longer. Yes. And I just could not do it anymore. So my PI, my committee, they agreed to allow me to take the research that I've done so far to write up my thesis, do my, public presentation. And then I left with my master's, and that's when I went on to pursue a CRA role, because that was wonderful. I feel like the MSL role and the CRA role, they're kind of similar, a little different, but kind of similar in their responsibilities, except one requires, more advanced degree and the other does not. But they're very similar in responsibilities and duties. So that's when I, discovered the CRA role and said, hey, this is a perfect fit for me. And I thought that, kind of like you with getting your articles and things published, I thought I was going to apply and I was going to get in, right? I had been to graduate school. I know I had a biology degree, biology, chemistry, bachelor's. I had a pharmacology master's, But boy, was I surprised, right? And it took a while. Like I went from study coordinator to clinical trial assistant to in-house monitor. I even did drug safety for a little bit. And then I got my CRA opportunity. So that took a while. And it was honestly a struggle. And I had to network. That was the big thing. I reached out to everybody because this was also a time where like LinkedIn, it kind of just came about and
Right.
people Googled stuff, but it still wasn't like it is today. People still made phone calls and, networked that way. So
Right.
I really had to network and, anybody that I could find that was in clinical research, I had a conversation. I asked them, how did they do it? What did they do? What did they like, dislike, pick their brain. I had to really piece together everything because there was not one place that you could go to as kind of like a one-stop shop to get everything you needed. And, there's those programs that taught you how to do the job. So they gave you the clinical research training, but they didn't really teach you how to get the job, which I felt like was the missing piece in terms of, the career development side of things, like how to structure your resume, how to strategize job searching and networking and interviewing, those types of things that I feel like anyways are really the key to getting those positions. Once you get them, they train you. But how do you get them, right? So that's what inspired my business and the coaching program and the course. That it all came from my own personal struggles. And me piecing everything together and just basically taking what I've learned to kind of like streamline that process and make it just a little bit easier anyways for the people coming up so that they can have like a clear, concise, strategy, a plan to go from A to B without wondering the entire time, am I really on the right track? Is this really the right thing to do? So it all came from my own personal struggles, honestly.
I think the intentional in the Insta is so important subconsciously and consciously because follow through is so important in this industry. As a monitor, following up with your sites. If you have an appointment with somebody and they don't, they have a problem, you texted me within 2 minutes of having internet issues, which I wasn't even worried about it. But that kind of personality is like so key to, the respect and the professionalism and the persistence. And it sounds so easy, but you really do have to get your pieces together and follow that intentional path. And I'm back even farther than you. Your story is so interesting, and hats off to you for really trying and networking and doing it. Even though it was a shorter time for me, I was very focused on, and I become almost obsessive. Well, who am I kidding? I am obsessive. I became obsessive about talking to my monitors, showing my monitors, because it's like I identified early on, this is what I wanted to do. I identified the people who I knew would help me. And it's not impressing people to get something from them. It's networking,
Right.
developing good skills, showing people you have the good skills,
Right.
building the trust, achieving your goal. And the byproduct is impressing people, making the connections, because you probably know this. Like someone said to me once, clinical research is the biggest small industry world in which you'll ever work. Don't burn bridges, right? And so here's like someone who was my boss 10 years ago was like a senior director at a company where I worked. We have a great relationship. Someone I worked with as a coordinator is now a manager, so it's like you networking to get the initial introductions, but then keeping those relationships and professionalism serves you so well. I mean, have you ever had that happen where you work for somebody and then 10 years later, they're like your boss or they're in a position in the company where you work and you're like, whoa, I knew you.
Yeah, I actually have. And even so, maybe so they didn't work where I was working, but if they were at another company, for example, one of the CROs at a VP level, and we were having a conversation. I don't even remember how we reconnected, but they just said, hey, would you like to come over and join us, over here? And sometimes that's how it works, right? Especially after you get that experience and you keep, networking and nurturing those relationships that you created and established. It literally works like that. And I tell my clients all the time, which is why the goal is not for them to not just get their first position, but to set up their marketing and branding, their personal marketing and branding in a way that it really sets them up for success, right? And they can really fast track their career. And networking is a big thing that we focus on because it's such a key component to everybody's success, right? And even more so in our industry, because as you said, it's a small world. It's a big industry, but it's such a small world in the grand scheme of things. And you never know who you're going to run back into one day, right?
I remember back when I started, EDC was like a novelty, right? This is a funny story, and I don't want to take too much of your time, but
Oh no, I love speaking with you. So
well, I love to speak with you too. I'll just be on the phone all day with you. My husband's like, "This is only going to take an hour, right?" I'm like, "Yeah, right." I'm kidding. I'm kidding. I remember when EDC was self-contained, where you had to have a computer to do EDC for the study. Like the pharmaceutical company assigned, I was a coordinator, every site their own laptop because it had to be self-contained on that system. And I don't even know how we did it. And I remember people were like, kind of what they did when risk-based monitoring came out, the people would grumble and go, oh yeah, well, this isn't, papered CRFs are here to stay or EDC. And then, now it's like people, I tease that the young people at clinical research today, the really young people, when I talk about the 3-part NCR, they're kind of looking at me like, what? Paper? I think we know what paper is. And it makes me laugh. And then it's like when risk-based monitoring came out, there was a lot of skepticism. And I get it because it's a change. And then now it's almost, par for the course more than you see risk-based models more than you see 100% SGF CRA review. And I just think that with every new technology, and the point of what I was trying to make was technology is such a vital part of clinical research. In what I do externally and in my position, I have to work on so many different computer systems and databases. And my husband is so funny because he's computer savvy in his own right. But he says to me, "You're so good." And I'm like, "Oh, thank you." And in my mind, I'm like, "No, I'm not. I've got you pulled up." I'm so computer savvy and I'm not. So anyway, I don't really know the point of all that was, but it's just so exciting and interesting the way that clinical research has, progress with the times and
it is
a lot about it.
I actually never had to deal with the paper CRFs, but I hear about them all the time. And then I'll hear some of the older oncology monitors talk about how they used to, when they travel, they had to have like a separate bag for all the papers that they had to lug around with them. And I think that it's so crazy to think about having to have like an extra suitcase just for the papers that they had to lug around.
Well, it's totally true. And, what you were told to never do, like if you interim analysis, we all know about that or data locks. And it was like literally you were doing you were finishing your monitoring on Friday afternoon and you were down the wire looking at your watch. You had to get 3 more, because I'm an oncology monitor too. I was. So you had to get 3 more, visit cycles monitored and sent in to meet the deadline for the data collected at that time point. And you're monitoring and you're looking at your clock and you're pulling your papers and you've got your UPS folder. And I tell the story so much and you're literally driving like crazy, Mario Andretti to the UPS drop box on the corner, throwing your UPS materials in there, which you had to take with you, and then trucking to the airport, hoping to make your flight. And hoping that UPS guy decides to not, go down to the local pub and instead of doing his pickup or her pickup. And you had to carry around UPS supplies. You had to carry around now you can just look up the code, ICH GCP guidelines and that 21 CFR, online. But I had to look up until like 5 years ago. I had to look this thing I would carry around with me. And it's like, no wonder I have good upper body strength. I had this bag that weighed 4,000 pounds. I mean, we used to have to do a lot, but it was fun and we did it. I remember when faxing things, and who even has a fax machine these days, but I remember when faxing CRF pages was like innovative and woo, So it's just, It's just funny.
And
I feel very fortunate to have been through so many interesting and awesome changes in this industry.
yeah, I always love to hear these stories. It's so cool to hear how it has really transformed. And even now, it's every year, right? It's constantly changing, constantly changing. And I wanted to ask you to share, what would you say would be the most challenging part of being a CRA? And then the most rewarding part, because everybody, when I ask them, I don't, a lot of people say they want to be a CRA, right? But I don't always I'm not quick to kind of work with everybody because they say they want to be a CRA, but do you really? Do you really, because they only think about the glamorous or the rewarding side. So what would you say would be the most challenging or the most thing you dread the most and then the most rewarding? So
That's a great question. Definitely can tell you the most challenging, and it's aligned with the type of personality that best suits suited for the job. I've always said, I'm a broken record, CRAs, clinical researchers are type A perfectionists, right? You yourself, I could tell within the first 5 minutes of speaking with you, you have this wonderful website, this wonderful thing, and you still feel like you could do better, which is why we will always try to do better, right? But it's a broad brushstroke, but it's true. The smartest, most accomplished people are the type A perfectionists. And I think that it's a wonderful quality, but I think it can also, what helps us can also hurt us the most, because if we make mistakes, it is devastating. And I remember one time I was monitoring an oncology study, probably 15 years ago, and I resist criteria. You're probably an expert at resist criteria. And I was very good at going back and calculating partial response, progressive disease, et cetera, et cetera. Well, it was brought to my attention by a really good study coordinator that I had missed a non-target lesion. So I thought the world was ending. It was no big deal, right? And even if it had been a really big mistake, you make a big mistake, you feel if you feel bad a little, fine, whatever. I'm not saying you should, but you learn. So that's method to. It's not the best for your your stomach and your nerves lesson wise, but it's the best as far as most people who make a mistake of significance do not make it again, right? So that mistake and other mistakes that I have made, because I'm too much of a perfectionist and I'm probably too sensitive, even though my skin is thickened up over the years, the mistakes that other people might in other industries might go, they can be devastating. And that is very hard and you really have to balance it, because when you're responsible for monitoring, I don't monitor anymore, but I did for years. I mean, I'm still a CRA, but in a different capacity.
Right.
When I was a monitor, it's a lot of responsibility, and you really have to have a balance, because you can obsess through the night. Did I do this right? Oh my gosh, I need to go back and do this and check this and this. And you really have to just do your job, monitor your cycles, you monitor your case books, and then move to the next. Right. So that can be a challenge, but it's not insurmountable at all. It just speaks to being able to let go, work your hours, do your job, think about your job, but literally put it on the back burner, because you can drive yourself crazy obsessing over, what if I did this wrong? What if I did that wrong? That's the biggest challenge for me, but it's definitely insurmountable, and it's certainly not any way prohibitive. The most gratifying and exciting part of the monitoring job when I was traveling, and then I'll relate it to videos and video conferencing, was being able to meet some of the most exciting, intelligent researchers I've ever met. I remember doing a monitoring visit where you've probably been in New York to monitor. Have you? Mm-hmm. So some of these investigational sites in New York, which is such great clinical research sites, they can have the lab on this street, and then 2 blocks over is the research center, and then 2 blocks over is the pharmacy. So I'm literally walking around in the springtime. No, sorry, it was Christmas time. And I was walking around on the streets of downtown New York City for work with a super interesting girl who was a coordinator, but she worked for the NIH. And we're talking about this study, and it was an oncology immunotherapy. And then over here, Rockefeller Center, and over here, Macy's. And I'm thinking, I'm getting paid right now to do my job. This is my job, right? Like just, and then in that respect, going to a small town in Idaho and meeting a wonderful doctor who's a family practice doctor who has a thriving research practice, alternatively, and just how passionate and smart and kind, and how the site was just like, when the snow was coming down, the coordinator called me on her way in and said, "Can I give you a ride?" I mean, just the people in this industry and the amazing, impressive, astonishing people. And we get to interact with them, and you're humbled by their humility, and you're excited by the circumstances and the opportunities. I mean, back when I monitored at UCLA, not 20 years ago, like 17 years ago, there used to be Fox Theater up there on the campus, Westwood campus, and we would monitor, and then we would watch the movie premieres from the restaurant where we were having dinner. And it was the Fox Theater, and it wasn't like a huge premiere of like a top, Nicole Kidman, Tom Cruise type thing, but it was smaller movies, but we still saw movie premieres. And I thought, and I'm not even into Hollywood, but at the time I thought, you have got to be kidding me that this is my job. And then another story, I was staying in the Beverly Hilton, when I monitored at UCLA. And I came back from working out and the Golden Globes were going on. And I'm not kidding you. I'm not kidding you. And of course, I was in my workout outfit. So I thought, great. No one cares about me anyway. But to my silly mind, I was like, oh, it's the Golden Globes and I'm in my workout outfit. But just the fact that we are doing what we're doing, this environment is like, what? And I mean, 21 years later, I'm still like so excited to talk about it. And I teach for a clinical research training program, and even not traveling and doing things, they had to pivot their whole curriculum to do Zoom calls, which they did successfully.
Yeah.
And it's called Clinical Research Fast Track. And even teaching this respect, being on a Zoom call with 25 people who are wanting to learn about clinical research, it's so inspiring. Like I pinch myself still thinking, I'm so happy I get to do this. So, I mean,
wow.
There.
And I have some clients that have also done the fast track program, which is really great. Of course, you guys cover the things that I don't.
Well, your program's different because you are more one-on-one coaching, the soft skills that are so, like I saw that, like you help people with LinkedIn and the interview, and that personalized touch is unique to what you do. So, I mean, it's so important, and it's part of the main process, but it's a different piece,
Right. And I was going to say to that point that having both, it's unfortunate that it's becoming so challenging to get in the industry, right? But kind of having both pieces is really the key. Like, you need something like Fast Track to give you that clinical research training, and then you need something like a CRA makeover to help give you that career development piece.
Right.
And a lot of people, they think, I guess like me, they think once you graduate, that's it, right? Everybody should be calling me. But it's so not true. It's so not true. And I get so many people reaching out and they're so frustrated. So I've done like discovery sessions with people that were interested and trying to get in, and they are literally on the calls crying because they have just, for what they feel like anyways, they've just been pouring out their souls, just searching, trying to get a job somewhere, trying to get a way in somehow. And they can't get a single response from anybody. And I feel so bad, but this is the key. And no one wants to hear that, I've invested all this into this particular degree, especially the people that have went, to graduate school and stuff. They don't want to hear that, well, actually, the degree doesn't matter so much. It's really these things. They don't want to hear that.
Well,
and it's unfortunate.
If they understand what you've talked about, like being prepared, being positive, and being patient. I mean, you have to, because even if you're not going to give up, which you can't give up, you have to be patient. There's no, well, try to be. You have to be, because if you're going to keep doing it, that's your only choice.
You're right. So right. And one thing that I wanted to definitely mention before we got off was, have you ever, I'm not sure if I asked you this before, but have you done contract work at all?
I have not.
Okay.
I have not done contract work, and I've always had to have a full-time job because I don't know, I'm a creature of habit, and I've worked in the CRO side for so long, and I just feel not fear at all, but I feel I just do better with the structure and the structure and the dependability, I guess. My husband has his own successful business, and I guess you could, he's not a contractor, he has his own corporation, but has more of a personality where he'll be busy for 9 months, and then for 2 months it won't be that busy, but he's dealt with it and is out networking, and he's got more of a calm personality for that. Have you done contracting before?
It's something that I'm interested in transitioning into. I would like to ask, people like yourself who built these successful careers, have you considered it? And then if yes, why? How do you like it? And then if no, why not? Just to, kind of get the two opinions.
I've talked to people who have just loved it and who would never go back to companies. And then I've talked to other people who tried it for maybe 4 years and were just like, too much unknown. So it just depends on your niche, your specialty, your personality. It's because you have such a strong oncology background. I think that you would be a prime person to make that transition, because oncology is COVID now, but oncology's always been like the most widely sought therapeutic area, right? At least in my opinion. Like, there's always going to be, someone said to me once, there's always going to be oncology monitors. So hats off to you if you do it. It's not for me, it certainly has not been for me, but it's been for a lot of people.
Yeah, it's definitely rough, right? It's different, and it's its own little beast within the CRA world.
It is very true.
Not for everybody. And sometimes I wonder, why is it for me? But I think it's more so because that's also what my focus was in graduate school. So I have like a little bit of a different perspective, since I did so much like basic bench science, that molecular cancer biology research. So it's not quite as bad, but the medical records, like going through that stuff, is the biggest challenge with oncology, because it's like one visit is like hundreds of pages that you have to go through, and God forbid it's an SAE. It's like hundreds of pages.
I remember when I was I don't mean to keep you. You're so fun to talk to. I remember when I was monitoring at a very large health organization in San Diego, but they're all over Southern California. Actually, they're all over California, and paper charts. This is probably 15 years ago, and I'm not even kidding you. 2 medical records for an oncology patient this thick. And I was excited that I got through the screening in 8 hours. My coworker said, wow, that was really good. And I felt, yeah, it was. But honestly, looking back, like that thick, 2 of them. And I thought, how did I do that? But I did. And I looked at everything.
Yeah, that is shocking. It is shocking. Sometimes screening can take 2 or 3 days, right? Depending on the patient and their previous history. That's
right.
Crazy. Wow. Well, I did want to give you an opportunity to talk about your 2 books. So like I said, this wonderful one, Clinical Research Trials and Triumphs. I really love it. I do. It's like a fun story. And I feel like it's something, especially the people that are like really just getting into the industry, trying to figure out, is this really for me or not? I really feel like this is a great read for them to not to scare anybody off. But I mean, you want to be honest, right? It's not a piece of cake. This industry really is. It can be very fun and rewarding, but it's work.
It is work. You are absolutely right.
Yeah. So I think this is a really great example of it. It's not always tough. I want to make sure I keep saying that and reiterating that to people. But there are challenging times. And this is a really great book to help you kind of get, kind of like a bird's eye view of how it can potentially be sometimes. And then this one, I actually like this one because, my program focuses more so on the career development side of things, but I do like to try to incorporate, at least on a quarterly basis, some type of, clinical research training, just the basics. I don't like to go in depth. But this has been a good guide of things to, little topics to kind of touch on here and there. So anybody that's thinking about being a CRA, I always recommend this book as well, because it's, I mean, you wrote it, So
Well, actually, you're so nice. I'm not the original authors. Karen Wood, yeah, you understand that. And John Schneider, they're the original authors. I'm to do the updates to the to the fourth and fifth editions. And I updated, a fair amount, but not, certainly not. I mean, I would say 40% maybe. But what's great about it is what they laid down back, 4 editions ago is, 25, 30 years ago, I don't even remember when it first came out, is still applicable.
Oh, yeah.
25 years later. And I was honored and fortunate to be able to do the updates. And it was like so surreal, because I remember training on the CRA's Guide to Monitoring Clinical Research when I was studying for the ACRP CCRA certification that I had. And I remember reading that book, in 2003, never imagining that in 2016, I would be doing the updates. Like that's surreal. That's like,
yeah,
wow. So, and then I say that humbly, like I am so fortunate that I was able to do that, and Centerwatch, asked me to, but it just shows, if you put your nose to the grindstone and work your keister off and believe in yourself, you can do amazing things that you would never imagine. I mean, look at you. You're a bench scientist. You are a successful CRA, and now you have a YouTube channel. And when you told me you had a YouTube channel, I was like, wow, I don't have a YouTube channel. That's pretty cool. So it's just, you're an example of also a person who is very successful, because you took chances, you took risks, you believed in yourself, you made mistakes, but you were determined to get there no matter what, right?
Thank you. And I just love the fact that you went from, monitoring, you have, you're still a CRA, like you said, but in a different capacity now. And then along the way, you've written these 2 great books. You've written for other, clinical research type of journals and things like that. You didn't talk on this, but you've also been invited to do speeches. So, I mean, it's amazing how I feel like the CRA role just opens up so many doors, because a lot of people think they can only be a project manager, line manager, trial manager, but you can really do anything, right? You can really go down any path.
And it's a great springboard, and it's and the belonging to professional societies, SOCRA, ACRP, really is beneficial, because you hit on it, networking, right?
Yeah.
Being active in LinkedIn. I mean, everything you do, even if it doesn't seem like it at the time, everything you do will help you. And the CRA role is the springboard. It really is.
Absolutely. And one thing I know, I keep saying this, I don't want to take up too much of your time, but I really wanted you, if you don't mind sharing how it is balancing being, in your personal life, being that you do have a family, you are married, because I get a lot of women who are concerned that they won't be able to stay married and be at CRE at the same time. And you'd be shocked. I get this question all the time, how do you monitor if you're married and you have kids? And they really think that as women, like, this is not, because, we have our society stereotypes and things, and, the woman isn't supposed to be out traveling type of stuff. But if you don't mind sharing that before, we leave, I'm pretty sure a lot of people would love to hear that.
Absolutely. And first I'll say hats off to people with partners, husbands, wives, who have kids and do this job, because I'm married, but I don't have children. I have 2 wonderful stepdaughters, but my husband, raised them. I was not really part of it. I was there, and I think I helped. My husband's a wonderful parent, so credit goes to him. However, I have had friends who had children and were managers or CRAs, and it was challenging, but they did it. I think the balance is having a partner who is understanding. My husband is a successful businessman. He is career obsessive. I am career obsessive, and I'm not saying obsessive in a toxic way.
Right.
I'm saying obsessive in a good way. And so I have a lot of support. When I travel to speak at conferences, my husband, if I can bring him with me, comes. One of the perks of being a traveling CRA was you get so many freaking flyer and hotel miles, you can bring your family with you up there. And it's actually really fun.
It is.
I hear CRAs talking about working on weekends. I mean, if you think you can be in clinical research and work only 40 hours in a week, being fully transparent, then you're probably in the wrong industry. I'm not saying you have to work 50, 70 hours a week, but 40 hours a week is not, this industry is probably not for you.
Yeah.
Or the medical field in general. But I hear people talking about working weekends, and I hear people talking about bringing their work computer on vacation. So I work long hours. I have a demanding career, but I also love what I do and I want to get my job done. But it is not prohibitive. And you do have to have a balance. Do I work weekends? Rarely. Sometimes I will work on a Saturday or Sunday to get an expense report done. Or if I have an early Monday meeting and I want to just look at my notes. But I would rather work 12 hours a day during the week, but have that weekend for balance. And that's really important. I also think that taking your computer on vacation, unless you absolutely have to, is crazy. As much as I can't let go of things, and sometimes I don't sleep well because I'm worried about my job and when I do a good job or worried about speaking here or whatever, I never take my work computer on vacation ever.
Oh.
Because, and I'm not criticizing. I mean, if you have or if someone else has, that's great. But I do not advise it because you need vacations to let go and not think, because then when you come back, you are fresh and 100% like when we go on vacation, we went this December, we were able to drive to Sedona and Vegas for a week. And I'm telling you, it was amazing because I did have work and I was hiking in Sedona and we went out to dinner because in California we couldn't, but in Vegas, we were able to do things on a smaller level, masking and social distancing and stuff. But the balance can be there, but you have to make the balance. And, but speaking to having kids, I think that the people who were traveling with children as CRAs, their partner, their husband, their spouse, there was somebody there home really helping out or family helping out. Like I had a friend whose mother would take care of her daughters when she was traveling and they lived together. And I had another friend who worked from home as a manager, but she had a nanny. And I'm not, those sometimes maybe that's not realistic, but you have to make it work and you can make it work. It just requires the right steps, the right situation, and the right people in your life to support.
Right. I agree 100%. Wow. So any last words that you would like to share, words of encouragement, or just one final thought you want to leave everyone with?
I do. I'm so happy. The final thought, besides, never give up on your career. I know it sounds silly, but being positive, being happy, being encouraging will serve you better than any controversy, negativity. And you have to believe in yourself. And I think that as women, especially, we have to help each other and lift each other and do not be negative or threatened by other people's success, because we have to pay it forward and be there for each other, especially as women, because, there are so many opportunities. I mean, I think the clinical research industry, I think for a while there were more female than male CRAs. So, I mean, like you just have to be there for each other. But I will say, I want to leave with, I'm so happy you reached out to me because it's been so great getting to know you. And I feel like I've found kind of a friend, and it's so cool to be able to have a connection like this. So thanks so much for the opportunity. This has been so much fun. It's fun. Clinical research is serious and hard, but it can be fun. Thank you. Thank you, Jasmine, for that. I really appreciate it.
Oh, no problem. Thank you so much.